Hello! Thanks for stopping by. If you're getting ready to enroll in Medicare soon, congratulations! In the next couple of minutes, you'll learn the basics, like what Medicare is and its different parts. Let's get started. Medicare is a national health insurance program started by the federal government in 1965. It helps cover your medical and prescription drug expenses if you are 65 or older, have certain disabilities, or have end-stage renal disease. Different parts of Medicare cover different things, but it's pretty simple to understand. There's Medicare Part A, B, C, and D. We'll help you remember which part is which. Medicare Part A covers hospital stays and skilled nursing facilities, including hospice or home health care. Let's say you get in an accident and end up in the hospital for a few days. Well, we hope that doesn't happen, but if it does, your Medicare Part A coverage will help you pay those costs. If you're wondering how much it costs to get Medicare Part A coverage, we have some good news. If you or your spouse worked for most of your adult life, your payroll taxes probably already paid for your Part A coverage. So now that you're more familiar with Medicare Part A, let's move on to Part B. You can think of Medicare Part B as your medical insurance. It covers doctor visits and services like surgeries, x-rays, or diagnostic tests. It also covers outpatient hospital care, durable medical equipment like a wheelchair, and some medical services and supplies not covered by Part A. Medicare Part B also gives you limited coverage for prescription drugs. With Medicare Part B, you get coverage for important preventative care services and screenings. Your coverage includes a one-time welcome to Medicare physical exam, and then an annual wellness visit every year after that. Think of these as yearly check-ins with your doctor to help monitor and manage your health on a regular basis. There's one more thing about Medicare Part B that you'll want to keep in mind. Most people pay a monthly fee called a premium for Medicare Part B coverage. The federal government sets this premium, which changes from year to year. So, we've gone through the basics of Medicare Parts A and B. But what about expenses they don't cover? Well, that's where Medicare Part C or a Medicare Advantage plan comes in. Medicare Advantage plans are approved by the government, but offered by private health plans. A Medicare Advantage plan gets you all of your Medicare Part A and Part B coverage, plus some additional coverage and benefits. So you could get extras like a wellness program or coverage for vision and hearing. You generally have to pay a premium for Part C coverage. There's a lot to know about Medicare Advantage plans, and there are other supplemental health plans available to cover what Medicare doesn't. We'll tell you all about these plans in our free detailed guide called Map to Medicare. You can learn how to get a copy at the end of the video. Okay, moving right along. You've probably noticed that Medicare's Part A, B, and C cover medical services and expenses, but we haven't mentioned much about prescription drug coverage. So, that brings us to the final part of Medicare, Medicare Part D. It works like this. The government contracts with private companies and health plans to offer Part D plans. The plans can be standalone, paired with separate medical coverage, or part of a plan that combines both your medical and drug coverage into one. Regardless of how you get Part D coverage, you will pay a monthly premium for it, unless you qualify for medical assistance. Your Part D plan helps pay some of the costs for your prescription drugs. With Part D coverage, when you go to your local pharmacy, you'll most likely pay less for your prescription than its retail value. Most of the time, you simply pay a copay or co-insurance for your drug. Another thing to know about Part D is it has 4 stages of coverage. In each stage, you pay a different share of the costs. It's important to consider Part D coverage when you're first eligible for Medicare. If you wait to enroll, you might end up paying an ongoing late enrollment penalty as part of your premium. So, research your options early. All right, we're almost finished. We just want you to know a few more key things before we let you go. You can enroll in Medicare during a 7-month time frame. You have 3 months before the month you turn 65, the month you turn 65, and 3 months after the month you turn 65. Enroll after the 7-month window is up, and you may have to pay a late enrollment penalty. There is a special exception if you're covered under your employer's group insurance past the age of 65. Once you're off your employer's insurance, you'll qualify for a special enrollment period and have a window of opportunity to enroll without penalty. So that's it. Thanks for watching. It's nice to know what Medicare can do for you. If you want more information about Medicare or plans from Blue Cross and Blue Shield of Minnesota available to you, here are a few suggestions. Call the number below to order a copy of our free guide called Map to Medicare. Visit bluecrossmn.com/Medicare. Call 1-866-999-4181, 8 a.m. to 8 p.m. daily. TTY users call 711. Talk with your local licensed agent or visit Medicare.gov. Blue Cross has been helping Minnesotans with health care for more than 80 years and has offered Medicare plans since the program began. We are committed to being Minnesota's healthcare leader and believe good health is for everyone. You can count on us to continue to provide the peace of mind that comes from knowing you're protected by the strength and stability of Blue Cross.